Hi, everyone. I'm Ken with Ken's Insurance Agency. We are a full insurance brokerage. We can help you with everything from health insurance to life insurance and retirement planning to auto, home to commercial and benefits packages. So today we're going to be talking about health insurance. We're going to focus more on the commercial side at this one. Then tonight we'll focus more on the individual side. We will be covering a little bit on the individual side for those tuning in that are basically individuals. So, as you can guess, with health insurance, there's two main categories: commercial and individual. Commercial insurance, you have your health plan, which can be a self-funded plan, an ACA plan, um, can be an actual health plan from a company like Aetna or Humana. Mm, can be ACA alternative plans. Some of them have commercial ability. So there's many different ways that you can have on health insurance. Now, for a full benefits package, there's other health plans you want to also consider, like dental, vision, accident, cancer, critical illness, hospital indemnity, disability. And the reason you want to consider these plans is because they end up lowering their workers' comp rate. They also will help to keep the employees from coming when they have a medical emergency and need funds from coming to you as the employer and asking you for funds. You can just basically send them to the policy that they've got. Most of these plans are guaranteed issue. So basically, very little underwriting, very little can knock you out, if anything. Uh, so it's very well to basically take advantage of this. Um, the accident, cancer, critical illness, hospital indemnity, disability, dental, vision. We also offer to our individual side. So those policies can be offered also to the individual side. So remember that. Um, Group sizes can be anywhere from 2 employees that sign up on up, but we do need to see everybody in the business. Um, and we have to have at least 70% participation rate. Also, we know when a cafeteria plan is good. We know when a cafeteria plan is bad, when it's going to affect your employees in the worst way, when it will help them in the best way. So, we're going to recommend what's best for both the employee and for the employer. Um, Usually, what's best for the employee is also best for the employer. A lot of companies out there, when they offer cafeteria plans, push them, and basically they don't want to maintain the group. And it's one of those things that the employer gets feed on it, and Basically, also when the employees start drawing off the money, they're getting taxed on it, so they're not happy with it. And then they basically get mad at the agent, mad at the company, um, mad at everybody because of it. And they're actually having to come back to the employer and ask for money again, which basically defeats the purpose, which makes the employer mad. Um, so there's reasons why, like the health plan should be cafeteria based. The supplemental plans should not be cafeteria based. We can also help with the retirement plans of um, a group and with life insurance of a group. Those are covered in other videos. So check out our commercial video and our life video um, for that information. Um, Also, for a commercial plan, we do offer group Medicare. Group Medicare is great. It offers health insurance and allows you to get the older generation that's going on Medicare off of your under 65 health to keep your rates low and still provide them with health insurance. And also, it gives a way for you to be able to not have to force them into retirement when they still may have many good years left in them within the company. Um, so those are the key factors of group slash commercial health insurance. On the individual side, again, we said we had the accident, cancer, critical illness, dental, vision, um, and disability, and we can put those on at least most of those on an individual, whether they're under 65 or 65 and older. With very few exceptions. Um, you also have um, your individual health for under 65. This could be a short term plan, a fixed indemnity plan, which is usually what the ACA alternatives are, or you could have an ACA type plan. Um, the ACA, which is the Affordable Care Act plans, they are not very affordable. They start out at about $750 for an individual and go up. About the only way to get them affordable is to be in that sweet spot where you get a nice subsidy that basically makes the plan either free or almost free, and maybe even get you some cost share. The problem is also if your income goes up or down, you have to report this immediately. If you do not, then at the end of the year, if your subsidy changed because of that, then you could end up owing back in big time. So that's one thing. We also can help you with Medicare. We give free Medicare education. So this is another thing to watch and be aware of and to be looking at. We do a webinar on, I believe it's the 15th for Medicare. So stay tuned for that. Um, so that gives you the information on healthcare. There's many other things we can put in a benefits package. Um, there's also one other thing that with healthcare that we've got now. We now have telecounseling and telehealth. So there's a webinar we're going to be doing on that. We got that at a very affordable rate so that you're not always having to run to a doctor's office or an urgent care center or a hospital every time you got a cold or a runny nose or a cough. You can just basically pick up the phone, call a board certified doctor, and get it diagnosed, get a prescription sent in, and go pick that prescription up and basically not have to be spreading it around work, not be having to spread it around the school and different things. You get it basically where it's taken care of. Also, with a board certified counselor, if you need a counselor for some reason to help you cope with some stuff, you got access to a board certified counselor that can help with that. So, contact us if you need help with a group plan or if you need help with an individual plan. We'll be glad to help you and we can help you save money on them. Thank you and have a nice day. Oh, and our number is 662-292-6271. And our web address is kensinsurranceagency.net. And we do recruit agents for this. So, and we're actually getting close to the end of our recruiting season for healthcare. So please contact us if you're interested in becoming an agent selling healthcare, whether on the commercial side or on the individual side, or both. Thank you and have a nice night.